skip calcium for a moment, not because calcium is useless, but because too many people have been looking in the wrong direction while their legs keep getting weaker, shakier, and less reliable with every passing year. As a doctor, I see this every single day. Patients walk into my clinic convinced that weak legs, knee pain, difficulty standing up, or fear of falling is just old age or low calcium. They've been swallowing calcium tablets for years, yet their legs feel heavier, slower, and less responsive. The problem is not effort. The problem is understanding. Strength is not built by minerals alone. Strength is built when the nervous system, muscles, and bones communicate properly, and that communication depends heavily on two vitamins that most people ignore until damage has already started. Weak legs are rarely about bones alone. Bones don't move you. Muscles do, and muscles don't work in isolation. They depend on nerve signals, energy metabolism, oxygen delivery, and inflammation control. When any of these systems break down, the legs are the first to show it. You feel fatigue when climbing stairs, you feel instability when walking, you feel pain when standing for long periods, and eventually you start avoiding movement altogether. That's when rapid decline begins. Calcium has been marketed as the hero for bone and leg health, but calcium without the right biological environment becomes almost useless. In some cases, excess calcium without proper guidance can even worsen stiffness, vascular issues, and muscle cramping. What truly restores leg strength is correcting the internal chemistry that allows muscles to contract powerfully, nerves to fire efficiently, and bones to support movement rather than restrict it. The first vitamin that changes everything is vitamin D. Not as a supplement trend, but as a biological necessity. Vitamin D is not just a bone vitamin. It is a hormone-like compound that directly affects muscle fibers, nerve conduction, and balance. In medical practice, low vitamin D levels are strongly associated with muscle weakness, frequent falls, leg pain, and slow recovery from physical activity. When vitamin D is deficient, muscles lose their ability to contract with full force. They become slower, weaker, and more prone to fatigue. What most people don't realize is that vitamin D receptors are found directly inside muscle cells. When vitamin D levels are adequate, muscle fibers respond faster and generate more strength with less effort. This is why patients who correct vitamin D deficiency often report something remarkable. They wake up feeling more stable. Standing up from a chair becomes easier. Walking feels lighter. The legs stop feeling like dead weight. Vitamin D also plays a critical role in calcium absorption. Without vitamin D, calcium simply passes through the body unused. So people keep adding more calcium, thinking the problem is deficiency, when in reality, the problem is utilization. Once vitamin D is restored, the body can finally use existing calcium properly, strengthening bones without overloading the system. But vitamin D alone is not enough. The second vitamin is the missing link between strength and control, between muscle power and coordination. That vitamin is vitamin B12. Vitamin B12 is essential for nerve health, and nerves are the command center of leg strength. Every step you take requires precise nerve signals traveling from the brain to the spinal cord and into the leg muscles. When B12 levels drop, those signals become weak, delayed, or distorted. The result is not just weakness, but numbness, tingling, poor balance, and a feeling that your legs don't fully obey you. Clinically, B12 deficiency often masquerades as aging. Patients describe dragging their feet, difficulty lifting their legs, or feeling unsteady in the dark. These are not just muscle issues, they are neurological symptoms, and they are reversible when addressed early. Vitamin B12 supports the myelin sheath, the protective coating around nerves. Without adequate myelin, nerve signals leak, slow down, and lose strength. Muscles may still exist, but they don't receive clear instructions. Restoring B12 allows nerves to fire cleanly again, improving coordination, reflexes, and muscle activation. This is why some people feel improvement surprisingly fast once B12 levels are corrected. When vitamin D and vitamin B12 work together, something powerful happens. Vitamin D strengthens the muscle fibers and improves calcium handling. Vitamin B12 sharpens the nerve signals that activate those muscles. The result is not just stronger legs, but more confident movement. Patients often describe it as waking up their legs overnight, not because muscles grow instantly, but because dormant systems start working again. As a doctor, I must be clear, no vitamin works in isolation, and no supplement replaces movement. But without these two vitamins, exercise becomes frustrating and ineffective. People try walking, stretching, or resistance training, yet see minimal progress because their internal biology is working against them. Once deficiencies are corrected, the same exercises suddenly produce results. Another overlooked effect of vitamin D is its role in reducing chronic inflammation. Low-grade inflammation silently damages muscle tissue over time, especially in the legs, which bear the most mechanical stress. Inflammation leads to pain, stiffness, and reduced mobility. Vitamin D helps regulate the immune response, calming unnecessary inflammation and allowing muscles to recover properly after use. Vitamin B12 also supports energy production at the cellular level. Muscles require energy to contract. When B12 is low, energy metabolism becomes inefficient, leading to rapid fatigue. This is why people with B12 deficiency feel exhausted, even after minimal physical activity. Restoring B12 improves stamina, allowing longer and more productive movement sessions, which further strengthens the legs. Many patients ask why leg weakness seems to appear suddenly. The truth is, deficiencies develop slowly. The body compensates for years until it can't anymore. When compensation fails, symptoms appear rapidly. That's why correcting deficiencies can feel dramatic. It's not sudden improvement, it's the removal of a long-standing bottleneck. Age does not protect against vitamin deficiency. In fact, aging increases the risk. As we grow older, the skin produces less vitamin D from sunlight. The digestive system absorbs B12 less efficiently. Medications commonly prescribed later in life can further reduce absorption. This creates a perfect storm for leg weakness, balance issues, and falls. Skipping calcium does not mean ignoring bone health. It means prioritizing the foundations that make calcium effective. When vitamin D levels are optimized, the body regulates calcium intelligently, directing it to bones rather than soft tissues. When vitamin B12 supports nerve function, muscles respond accurately, reducing the risk of injury. The phrase overnight is often misunderstood. Healing begins immediately when the body receives what it has been lacking. Some people notice changes within days. Less pain, better balance, improved confidence. Others take weeks. The key is consistency and addressing the root cause rather than chasing symptoms. From a clinical perspective, the most dangerous aspect of weak legs is not discomfort, it's loss of independence. Difficulty walking leads to reduced activity leads to muscle loss leads to instability leads to falls change lives. This cascade can often be interrupted simply by correcting nutritional deficiencies early. It is also important to understand that leg strength is deeply connected to the brain. When nerve signals improve, the brain regains trust in the body. Movement becomes less cautious, more fluid. Confidence returns. This psychological component is often overlooked but plays a major role in physical recovery. Vitamin D has also been shown to influence muscle fiber composition, supporting fast twitch fibers responsible for quick, powerful movements. These fibers are crucial for preventing falls and maintaining agility. Without vitamin D, these fibers shrink and weaken disproportionately. Vitamin B12 supports red blood cell formation, improving oxygen delivery to muscles. Better oxygenation means better endurance, faster recovery, and less cramping. Many people who suffer from night leg cramps or persistent calf tightness find relief when B12 levels are restored. Doctors do not look at leg weakness in isolation. We see patterns: low vitamin D, low B12, reduced activity, chronic pain, fear of movement. Breaking this cycle requires addressing all parts, but nutrition is often the easiest place to start. the body is remarkably resilient. Muscles respond quickly when given the right signals, nerves repair themselves when supported properly, bones remodel continuously when mechanical stress and nutrition align. This is why improvement is possible at any age. There is also a misconception that supplements are only for deficiency. In reality, modern lifestyles make deficiencies common. Limited sun exposure, processed diets, digestive issues, and chronic stress all interfere with vitamin absorption and utilization. As a physician, I advise patients to think of vitamins as tools, not magic pills. Vitamin D and B12 create the internal conditions necessary for strength, but movement is what builds it. Walking, gentle resistance, balance exercises, all become more effective when these vitamins are sufficient. Skipping calcium also reduces the risk of oversupplementation, which can contribute to kidney stones or vascular calcification in susceptible individuals. A balanced approach is safer and more effective. Weak legs are not a life sentence. They are a signal that the body needs support, not surrender. When patients understand this, they stop blaming age and start rebuilding strength intelligently. The medical community increasingly recognizes the role of vitamin D and B12 in musculoskeletal and neurological health. These are not alternative ideas. They are supported by growing clinical evidence and everyday patient outcomes. Leg strength is freedom. It is the ability to move without fear, to stand without pain, to walk without hesitation. When vitamin D restores muscle function and vitamin B12 restores nerve control, that freedom becomes achievable again. Ignoring these vitamins while focusing only on calcium is like trying to build a house by stacking bricks without cement or wiring. The structure exists, but it cannot function properly. The body heals best when systems are aligned. Muscles, nerves, bones, and the brain must work together. Vitamin D and B12 help restore that coordination. This is not about chasing youth. It is about preserving function. Strong legs mean independence, confidence, and quality of life. Medicine is not just about treating disease, it is about maintaining the ability to live fully. When people finally correct these deficiencies, they often say the same thing: "I didn't realize how weak I had become until I felt strong again." That realization is powerful. It changes how they move, how they think, how they live. Leg strength does not vanish overnight, and it does not return overnight either. But the process begins the moment the body receives what it needs. And for many, that moment starts by looking beyond calcium and addressing the two vitamins that quietly control strength from within. Rebuilding leg strength is not just a physical transformation. It is a transformation of life itself, a reclamation of independence that begins long before anyone notices the visible changes in muscle size or definition. Many people assume that strength is purely aesthetic, that the only sign of improvement is a bulging calf or a toned thigh. This misconception has led countless individuals down the wrong path, focusing on outward appearances rather than the underlying systems that truly determine leg function. The truth is that the legs are the foundation of mobility, and mobility is the foundation of independence. Without strong, reliable legs, every action, standing, walking, climbing stairs, carrying groceries, even simply getting up from a chair becomes an effort, a decision fraught with uncertainty and potential risk. Leg weakness, especially in older adults, is directly linked to loss of independence, increased risk of falls, and a diminished quality of life. This makes the process of rebuilding leg strength far more critical than simply chasing aesthetics. The first step in rebuilding leg strength is understanding that independence is not about outward appearance. It is about function. Function is determined by the coordinated work of muscles, nerves, bones, and the brain. Muscles generate the force, but they cannot operate in isolation. They require clear, consistent signals from the nervous system. They need proper nutrition to contract effectively. They depend on bones to provide structure and leverage, and they rely on the brain to regulate balance, coordination, and the timing of each movement. When any of these systems are compromised, even slightly, the legs become less reliable, and independence begins to erode quietly over time. The earlier one recognizes this, the faster recovery can begin. This means that the focus should be on functional improvement, regaining stability, endurance, and coordination, rather than waiting for visual cues such as size or tone, which often lag behind true strength gains. Nutritional support plays an indispensable role in this process. Vitamins such as D and B12, along with other micronutrients, directly influence muscle function and nerve efficiency. Vitamin D, for example, enhances calcium absorption, regulates muscle contraction, and supports bone integrity, while also modulating inflammation that can slow recovery. Vitamin B12 ensures that nerve signals are transmitted efficiently and maintains the myelin sheath, which is critical for rapid and coordinated movement. When these nutrients are deficient, muscles may appear functional, but they lack the underlying capacity to perform reliably under stress. In practice, patients often report that their legs feel weak, unsteady, or fatigued even before any visible atrophy occurs. Correcting these deficiencies often produces dramatic improvements in daily function before any significant change in appearance is noticed. This functional restoration is the true marker of regained independence. The legs become more responsive, movements smoother, and confidence returns, which is perhaps the most important measure of strength, because it dictates whether a person will continue to move and challenge themselves. Rebuilding leg strength also requires addressing the neurological component of movement. The nervous system is the central command center for all physical activity. Each step requires a complex cascade of signals from the brain, down the spinal cord, and out through peripheral nerves to each muscle fiber. When this communication is impaired, whether due to vitamin deficiencies, age-related nerve degeneration, or lack of stimulation, the legs cannot perform at their potential. Coordination falters, reflexes slow, and the risk of imbalance increases. This is why strength training alone may not be sufficient. Functional recovery demands exercises that challenge balance, proprioception, and neuromuscular efficiency. For example, incorporating single leg movements, controlled squats, and step-ups engages both muscles and nerves simultaneously, enhancing the brain-muscle connection. Over time, this restores not only physical strength, but also confidence in mobility, which is a critical component of independence. Patients often report that after weeks of targeted, nerve-focused training, they feel more capable of moving through crowded spaces, navigating stairs, and performing daily tasks that previously caused hesitation. One of the most overlooked aspects of rebuilding leg strength is the psychological impact of regained function. Weak legs do not only limit movement, they impose a mental restriction. Fear of falling, concern about fatigue, and anticipation of pain all contribute to a gradual withdrawal from physical activity. This withdrawal accelerates muscle loss, decreases cardiovascular fitness, and fosters a cycle of dependency. By focusing on functional strength first, individuals experience an immediate boost in confidence. Simply knowing that one can rise from a chair without struggle or navigate a hallway without fear can transform daily living. This psychological reinforcement encourages further movement and engagement in physical activity, which, in turn, continues to strengthen the legs. The process becomes self-reinforcing. Functional recovery fosters confidence, which encourages movement, which builds true strength, creating a foundation for long-term independence. Rebuilding leg strength before visible muscle growth also allows the body to adapt safely. Muscles, tendons, ligaments, and joints need time to adjust to increased loads and stresses. Attempting to chase muscle size without first addressing coordination, balance, and endurance can lead to injuries, setbacks, and discouragement. By prioritizing functional recovery, individuals build a robust framework that supports gradual and sustainable muscle development. This approach emphasizes low-impact exercises, progressive resistance, and attention to proper movement mechanics. For example, starting with bodyweight exercises such as controlled squats, lunges, and step-ups builds strength in a safe, controlled manner while also improving balance and joint stability. These early gains may not be visible to the outside observer, but internally the body is undergoing a profound transformation. Muscles become more responsive, nerves more precise, and joints more stable, setting the stage for later hypertrophy without compromising safety or independence. Another critical component is the role of cardiovascular health in leg strength. The legs are highly dependent on blood flow for oxygen, nutrients, and waste removal. Even modest deficits in circulation can impair muscle performance, recovery, and endurance. Cardiovascular exercises, such as walking, cycling, or swimming, support vascular health, enhance oxygen delivery, and stimulate nutrient transport to the muscles. Combined with proper nutrition and neuromuscular training, cardiovascular conditioning amplifies the effects of leg strengthening programs. Patients often notice increased stamina, reduced fatigue, and smoother movement patterns before their legs appear visibly stronger. This functional improvement is central to regaining independence because it enables sustained activity throughout daily life, not just isolated bouts of exercise. The ability to walk longer distances, climb stairs with ease, and stand for extended periods without discomfort directly translates into autonomy and quality of life. Flexibility and mobility are additional dimensions that influence leg strength and independence. Muscles may be strong, but tightness or restricted joint range can limit their effectiveness. Stretching, dynamic war, MUPs, and mobility drills ensure that muscles can operate through their full range, that joints move fluidly, and that coordination remains intact. These practices reduce the risk of injury, enhance balance, and improve overall movement efficiency. Importantly, the benefits of improved flexibility are often felt immediately in daily life. Simple actions like bending to tie shoes, rising from a low chair, or stepping over obstacles become easier, reinforcing a sense of independence even before muscle size changes are apparent. Rebuilding leg strength also involves addressing lifestyle factors that impact recovery and performance. Sleep, hydration, stress management, and nutrient timing all influence how effectively muscles and nerves respond to training. Sleep is particularly crucial, as it is during rest that muscle repair, neurological recovery, and hormone regulation occur. Inadequate rest impairs coordination, slows strength gains, and increases fatigue. Hydration affects muscle contraction, joint lubrication, and overall endurance. Stress hormones such as cortisol can break down muscle tissue and impair nerve function if chronically elevated. By optimizing these lifestyle factors alongside targeted exercise and nutritional support, individuals accelerate functional recovery, regaining independence and mobility far sooner than by exercise alone. A medical perspective emphasizes early intervention. Weak legs often progress silently, with small deficits in strength, balance, or endurance accumulating over months or years. Waiting for visible muscle loss or overt disability often means that recovery will be slower and more challenging. Functional assessment, testing balance, gait, reaction time, and endurance, can identify deficits early, allowing targeted interventions that restore independence rapidly. Even subtle improvements in these metrics can translate into meaningful changes in daily living. Patients frequently report that after correcting deficiencies and engaging in functional training, they can perform tasks they had avoided for years, such as carrying groceries, climbing a flight of stairs, or walking to the mailbox, long before any visible muscular transformation occurs. Community and social engagement further reinforce the benefits of functional leg strength. When individuals regain the ability to move confidently, they are more likely to participate in social activities, attend group exercise classes, or engage in outdoor recreation. These interactions not only provide motivation to continue training, but also enhance mental health, mood, and overall quality of life. Independence is not merely the absence of physical limitation. It is the ability to live a full, engaged life. Restoring leg function empowers individuals to reclaim social roles, pursue hobbies, and maintain autonomy in daily routines, often preceding any visible signs of muscular change. Rebuilding leg strength before visible muscle growth also reduces reliance on assistive devices. Walkers, canes, or railings are often introduced when weakness is advanced, limiting freedom of movement and independence. By focusing on functional strength, individuals can delay or avoid the need for these supports. The ability to stand unassisted, take confident steps, and recover from minor stumbles provides a psychological and practical sense of autonomy that is invaluable. The legs become tools of freedom rather than sources of limitation. This shift in perception, seeing legs as capable rather than fragile, is as important as the physical improvements themselves, fostering a mindset that encourages continued activity and self-sufficiency. A holistic approach to rebuilding leg strength integrates multiple dimensions: nutrition, neurological function, cardiovascular health, flexibility, lifestyle factors, and psychological confidence. This integrated strategy ensures that gains are functional, sustainable, and directly tied to independence. Patients often find that the most rewarding outcomes are not the first visible signs of muscle growth, but the immediate improvements in stability, endurance, and control that allow them to move freely and confidently. These gains often precede hypertrophy by weeks or months, highlighting the distinction between functional strength and aesthetic appearance. Medical evidence supports this approach. Studies consistently show that interventions targeting muscle function, neuromuscular coordination, and nutrient optimization produce measurable improvements in mobility and independence, even in the absence of significant muscle size increase. Elderly patients who engage in such programs experience fewer falls, reduced fear of movement, and improved quality of life. Younger adults recovering from injury or sedentary lifestyles regain confidence and agility more quickly when functional gains are prioritized. These outcomes demonstrate that independence is restored through coordinated improvement of internal systems, rather than through visible musculature alone. Rebuilding leg strength before muscle growth also has preventive benefits. Strong, functional legs reduce the risk of falls, injuries, and chronic pain, which are major contributors to long-term disability. By focusing on functional capacity, individuals create a resilient foundation that supports all future physical activity. When muscles eventually grow, they do so on a platform of coordination, balance, and endurance, making them less susceptible to strain or injury. In this sense, functional leg strength is both restorative and protective, ensuring independence is not only regained but maintained over time. The process is gradual, measurable, and empowering. Initial improvements may be subtle: a firmer step, steadier balance, quicker recovery after a short walk. But these small victories accumulate. They reshape daily life, restoring confidence and autonomy. Patients begin to trust their legs again, engage in longer walks, participate in household chores, and reclaim activities that were previously abandoned due to fear or fatigue. This restoration of independence transforms the way individuals interact with their environment, their families, and themselves, reinforcing the importance of functional recovery as the true marker of strength. Rebuilding leg strength is also about resilience. Strong, functional legs enable individuals to respond effectively to unexpected challenges, catching themselves from a stumble, stepping over obstacles, or recovering from minor injuries. This dynamic capability goes far beyond what can be measured by muscle circumference. It reflects a system-wide improvement in coordination, nerve function, and muscular responsiveness. Independence is not only about routine movement, but about the ability to adapt to the unexpected, a capacity that is cultivated long before visible muscle growth appears. Functional leg strength supports other aspects of health as well. Enhanced mobility encourages cardiovascular fitness, stimulates bone density, reduces metabolic decline, and supports mental health. When individuals move with confidence and control, they naturally engage in more physical activity, creating a positive feedback loop. The body responds with improved endurance, strength, and resilience. Over time, visible muscle growth may occur as a byproduct of consistent functional use, but the primary victory, the restoration of independence, comes first. In summary, the restoration of leg function begins internally through improved coordination, nerve signaling, nutrient support, cardiovascular efficiency, and psychological confidence. These gains translate directly into independence, allowing individuals to navigate daily life with assurance and capability. Muscle growth may follow, but it is secondary to the regained freedom to move, act, and engage with the world without restriction. Rebuilding leg strength is ultimately about reclaiming autonomy, confidence, and quality of life. And it begins long before anyone notices the outward appearance of the muscles themselves.